Good morning, and thank you for spending a little time with me today. If you're listening quietly right now, perhaps with a cup of tea nearby or sitting somewhere familiar and comfortable, you're exactly where you need to be. As we move past 60, many of us start hearing the same messages repeated over and over. Look after your heart, watch your blood pressure, manage stress, eat well, stay active. All of that matters, of course. But for many people, there's a quiet sense that something still feels unsettled. You might be doing most things right, yet you still find yourself thinking about your heart, your blood pressure readings, or how your body feels compared to a few years ago. Not with panic, but with a low, persistent question in the background. And often, there's one familiar part of the picture that doesn't get much attention at all. The medications you take every day, not unusual drugs, not rare prescriptions, just the tablets that have slowly become part of your routine over the years. This conversation isn't here to alarm you. It's not here to tell you to stop taking anything. And it's certainly not here to suggest you've done something wrong. Instead, this is simply a chance to look at how the body changes after 60 and how those changes can alter the way medications affect the heart, the circulation, and overall well-being. Many people are never invited into this kind of discussion. Prescriptions get renewed. Symptoms are explained away as just part of aging, and life moves on. But understanding brings calm. When we understand how the body works now, at this stage of life, we're better able to support it without fear or urgency. So today, let's slow things down. Let's talk quietly, without pressure. And let's begin by looking at why something as ordinary as medication deserves a little more thoughtful attention as we get older. This is a conversation, not a warning. One of the quiet misunderstandings about aging is the idea that if something feels different, something must be wrong. After 60, many people carry an unspoken sense of guilt about their health. Maybe I should have exercised more. Maybe I should have eaten better. Maybe I waited too long. But the body doesn't work that way. What actually changes with age is not whether the body works, but how it responds. The liver processes substances more slowly than it once did. The kidneys filter blood less efficiently, even when blood tests look normal. The cardiovascular system becomes more sensitive to shifts in fluid, pressure, and medication levels. These changes are not failures, they are adaptations. Something that felt completely fine at 45 can feel heavier, stronger, or more draining at 70, not because you did something wrong, but because the body now needs a different pace and different margins. This is especially important when it comes to medication. Many prescriptions are started at a time when the body is more resilient. They work well, they help, so they continue. Years pass. The prescription stays the same, but the body doesn't. And this is where confusion often creeps in. People assume, if I've been taking this for years, it must still be right for me. But time itself changes the context. The issue is rarely that you're taking the wrong medication. More often, it's that the body receiving it is no longer the same body. Understanding this can be surprisingly freeing. It shifts the story away from blame and toward awareness. Instead of asking, what did I do wrong? The question becomes, what does my body need now? That single shift lowers defensiveness. It opens space for better conversations, clearer choices, and calmer decisions. Because after 60, health isn't about correcting mistakes. It's about responding wisely to change. One of the reasons medications deserve a gentler look after 60 is this simple fact. Very few medicines act on only one part of the body. We often think of a tablet as doing one job: pain relief for joints, something to help sleep, a pill to steady blood pressure. But inside the body, medications move through shared systems. They pass through the liver. They are filtered by the kidneys. They influence fluid balance, blood vessels, and heart rhythm along the way. In younger bodies, these systems are more forgiving. They adjust quickly. They clear substances efficiently. They recover with little effort. With age, that flexibility narrows. After 60, the body becomes more sensitive to shifts that once went unnoticed. A medication that slightly increases fluid retention may now raise blood pressure. A drug that gently slows the nervous system may now affect balance or heart rate. Something meant to calm one symptom may quietly strain another system. What makes this challenging is that these effects are rarely dramatic. There's no sudden pain, no clear warning sign, no obvious moment when something goes wrong. Instead, the changes are subtle. A little more swelling by the evening, blood pressure that creeps up despite doing everything right. Feeling more tired, more unsteady, or less sharp than before. It's easy to blame aging itself, but often the issue isn't age alone. It's how age changes the body's response to medications. This doesn't mean medications are harmful or should be feared. Many are essential and genuinely life-supporting. What it does mean is that after 60, the margin for unnoticed side effects becomes smaller. The heart, in particular, feels these shifts early. It responds to changes in fluid, pressure, and rhythm long before symptoms appear. Understanding this helps reframe the conversation. Not, is this drug bad? But is this still the right fit for my body now? That awareness prepares us to look more closely at specific medication groups, calmly and thoughtfully, which is exactly where we'll go next. Let's begin with a group of medications that almost everyone recognizes. Pain relievers such as ibuprofen and naproxen. They're familiar. They're easy to access. And for many people, they've been part of daily life for years. A sore knee, a stiff back, arthritis flaring up. Reaching for one of these tablets often feels routine, almost harmless. And for short-term use, in the right situations, they can be helpful. The important part to understand is not that these medications are bad, but how they behave differently in the body after 60. These drugs don't only reduce pain, they also influence how the kidneys manage fluid and salt. In younger bodies, the kidneys adjust quickly. They release excess sodium and water without much strain. With age, even healthy kidneys become less efficient at fine adjustments. When certain pain relievers interfere with that process, the body may quietly begin to hold on to fluid. This doesn't usually feel dramatic. You might notice your shoes feel tighter by evening. Your legs feel heavier than usual. You tire more easily. Or there's mild swelling around the ankles that comes and goes. Many people assume this is just part of aging, but often it's the heart responding to extra fluid. When the body holds more water, the heart has to pump against a higher volume. Blood pressure can rise slightly. Circulation feels more effortful. None of this announces itself loudly. That's why this becomes an aha moment for many people. Not because they were doing something wrong, but because no one ever explained the connection. Using these medications occasionally is very different from using them daily. Taken every day, especially over long periods, they can quietly increase strain on the heart and kidneys, particularly in people who already have blood pressure concerns. This isn't a call to throw anything away, and it's certainly not a suggestion to live with untreated pain. It's simply an invitation to pause and ask, Do I still need this every day? Is there a gentler option for me now? Sometimes the answer is adjusting how often it's used. Sometimes it's exploring alternatives, like topical treatments, movement-based support, or different pain strategies. And sometimes it's just having an informed conversation with your doctor. Because after 60, medication decisions aren't about rules. They're about fit. And the best choices are made when the body is listened to, not pushed. In the next part of our conversation, we'll move to a very different group of medications, ones that affect the nervous system, sleep, and calm, and why they can quietly influence balance and heart health in ways many people don't expect. Let's move to another group of medications that many people over 60 quietly rely on. Medications for sleep and anxiety. If you've ever struggled to fall asleep, stay asleep, or calm a restless mind at night, these medicines can feel like a relief. They help the body slow down. They make sleep feel possible again. They reduce that constant edge of worry that can creep in during later life. And for some people, at certain moments, they are genuinely helpful. The part that deserves more attention is what they ask in return. These medications work by slowing activity in the nervous system. That's why they ease anxiety and promote sleep. But the nervous system doesn't only control thoughts and emotions. It also controls reflexes, balance, coordination, and reaction time. As we age, those systems are already a little less forgiving. When they're slowed further by medication, even slightly, the effects can become noticeable in daily life. Getting up at night to use the bathroom, standing too quickly in the morning, turning without thinking. Reflexes that once adjusted automatically may respond a fraction of a second later. And after 60, that fraction matters. This is why falls become such an important part of the conversation. Not because anyone is careless, but because the body's safety margins are smaller. A fall after 60 is no longer a minor inconvenience. It can mean fractures, hospital stays, loss of confidence, and sometimes loss of independence. What makes this especially difficult is that the connection isn't always obvious. People may notice feeling a little foggier, a bit unsteady, more cautious when moving, and they often assume this is simply aging. Rarely does anyone think to ask whether a sleep or anxiety medication might be contributing. There's also another quiet issue: dependence. Over time, the body adapts. The medication feels less effective. Stopping suddenly can feel frightening or uncomfortable. This is why the message here is not to stop, and never to stop abruptly. Instead, it's about review, revisiting whether the medication is still needed in the same way, whether the dose is still appropriate, whether alternatives might now make more sense. After 60, medication isn't just about relief. It's about safety, balance, and preserving confidence in everyday movement. In the next part of our conversation, we'll look at a group of medications many people take for digestion and reflux, and why long-term use can quietly affect the heart, bones, and overall resilience in ways few people expect. Let's talk about a group of medications that many people take so routinely, they almost fade into the background. Stomach acid-reducing medications, often called PPIs. They're commonly used for heartburn, reflux, or stomach discomfort. And when symptoms are severe, they can be genuinely helpful. These medications work by reducing the amount of acid the stomach produces. That's their job. And in the short term, they do it well. The part that often goes unspoken is what happens when short-term solutions quietly become long-term habits. Stomach acid isn't only there to cause discomfort. It plays an important role in helping the body absorb key nutrients, including calcium, magnesium, iron, and vitamin B12. When acid levels stay low for long periods of time, absorption can slowly decline. Not suddenly, not dramatically, but gradually. Over time, this can affect bone strength. Calcium that isn't absorbed doesn't help maintain bone density. Muscles may feel weaker. Fatigue may creep in. Low vitamin B12 can contribute to tiredness, numbness, balance issues, or mental fog that's often mistaken for just getting older. What's important to understand is that these effects don't usually appear right away. There's no clear signal that says, this medication is now causing a problem. Instead, people may feel more run down, less resilient, a little less steady on their feet. And because these changes happen slowly, the medication is rarely questioned. The key point here isn't that these drugs are bad. It's that they were designed for temporary use, yet many people continue them for years without review. After 60, every medication deserves to be revisited from time to time, not with fear, with curiosity. Asking simple questions can make a difference. Do I still need this every day? Could the dose be lower? Are there other ways to manage symptoms now? Understanding how one system affects another helps us see the body as a whole. And that broader view becomes especially important as we move forward in this conversation. In the next section, we'll look at heart and blood pressure medications themselves and why even helpful prescriptions sometimes need gentle readjustment later in life. Heart and blood pressure medications deserve special care in this conversation, not because they're dangerous, but because they're important. For many people, these medications have been genuinely life-saving. They reduce strain on the heart, they protect blood vessels, they help prevent serious events. So let's be very clear from the beginning. This is not about mistrusting heart medication. And it's certainly not about stopping anything on your own. What matters here is understanding how the body changes after 60. As we age, blood vessels naturally become less elastic. The nervous system responds more slowly to changes in posture. Kidneys handle fluid and electrolytes with less margin for error. Because of this, a dose that was perfectly balanced at 50 may feel different at 70. Sometimes heart medications continue working exactly as intended. They lower blood pressure. They slow the heart rate slightly. They reduce workload. But in an older body, that same effect can occasionally become too strong. This is when people begin noticing things like feeling lightheaded, when standing a vague sense of fatigue that wasn't there before mental fog or reduced alertness, a feeling of being slightly off, without knowing why these sensations are often dismissed as aging. But sometimes they're signals that the body is receiving more pressure, reduction, than it currently needs. This doesn't mean the medication is wrong. It means the body has changed. Blood pressure that drops too low can reduce steady blood flow to the brain. A heart rate that's slowed too much can affect energy and balance. Fluid shifts can increase fall risk, especially during sudden movements. None of this happens dramatically. There's rarely a sharp warning. Instead, it shows up quietly. And because the medication has been trusted for years, it's rarely questioned. The most important message here is this: heart medications are not static tools for a static body. They work best when they're revisited from time to time, adjusted gently, reviewed with attention to how you actually feel, not just what numbers say. The medication isn't wrong, and you haven't done anything wrong. The body has simply moved into a new phase, and sometimes the best care is not adding more, but recalibrating what's already there. In the next part of our conversation, we'll look at what happens when several medications are taken together and why the combination itself can sometimes become the real issue. There's one reality of later life that often stays unspoken, even in medical settings. Many people over 60 are not taking just one medication. They're taking 5, sometimes 7, sometimes 10 or more, and this has become surprisingly common. A tablet for blood pressure, another for cholesterol, something for sleep, something for pain, something for the stomach. Perhaps supplements added along the way. Each medication may have been appropriate at the time it was prescribed. Each one may still make sense on its own. The concern isn't any single pill. It's the total load the body is asked to manage every day. As we age, the liver processes medications more slowly. The kidneys filter less efficiently. The nervous system becomes more sensitive to chemical signals. When several medications are taken together, interactions can occur quietly. Not dramatic reactions, subtle ones. Feeling more tired than usual, a sense of mental fog, reduced balance, less motivation, occasional confusion. These symptoms are very often dismissed as just getting older. But sometimes they're not aging at all. They're the body struggling to keep up with complexity. Another challenge with polypharmacy is what's called a medication cascade. One drug causes a side effect. That side effect is treated with another drug, and over time the original issue becomes harder to identify. None of this means medication is bad, and it certainly doesn't mean everything should be stopped. It simply means that after 60, more is not always better. One of the most supportive steps an older adult can take is a thoughtful medication review. Not rushed, not judgmental, just a calm look at what's still needed, what might be adjusted, and what may no longer be serving the body as it once did. Sometimes improving health isn't about adding something new. It's about lightening the load so the body can breathe again. In the final part of our conversation, we'll bring all of this together and talk about what truly matters most as we protect heart health and independence over time. At this point, it's important to pause and make one thing very clear. Nothing we've talked about today is an invitation to stop medication on your own. Medications save lives. They manage symptoms. They protect the heart, the brain, and many other systems. The goal here is not fear, and it's certainly not rebellion against treatment. The goal is understanding and thoughtful review. After 60, the most helpful question is rarely, should I be taking this? It's more often, is this still the right dose for this body at this stage? A medication review doesn't need to be complicated. It starts with something very simple. A clear list. Every prescription medication, every over-the-counter pill, every supplement, even the ones that feel harmless. Bringing that list to a dedicated review appointment allows your doctor or pharmacist to see the full picture, not just one piece at a time. The next step is asking calm, practical questions. Questions like, do I still need all of these? Have any of my doses become too strong for me now? Could some of my symptoms be medication-related? Are any of these working against each other? These are not challenging questions. They're responsible ones. A good review is not about taking everything away. Often it's about small adjustments, lower doses, simpler combinations, clearer priorities. Many people are surprised by how much lighter they feel afterward. Less fog, more steadiness, more energy, not because something dramatic changed, but because the body was finally given a chance to work with less strain. In the final part of our conversation, We'll step back and talk about what all of this really points toward: protecting independence, clarity, and calm as we move forward. As we come to the end of today's conversation, there's no final warning to give and no single rule to remember. What matters most is something much quieter than that. Understanding leads to calm. Calm makes space for better choices, and better choices, made steadily, help us stay independent and grounded as we move forward. Nothing we've talked about today was meant to frighten you or make you question every decision you've ever made. It was simply an invitation to look at your health with a little more clarity and a little less pressure. After 60, being proactive doesn't mean doing more. It often means pausing, asking the right questions, and allowing your care to evolve along with your body. That's what this space is for. Senior Health Conversations isn't here to tell you what to stop or what to start. It's here to sit alongside you, to offer context, and to help health feel less overwhelming and more manageable. If this conversation felt familiar, or if it helped something click into place, that's already enough for today. You're very welcome to stay with us. Some people choose to give the video a like as a quiet sign of support. Others subscribe, so these conversations find them again when they're needed. And some simply leave a small comment, even just a hello. All of those are enough. What matters most is knowing you're not navigating this stage of life alone. We'll keep these conversations going calmly, respectfully, and without urgency. Thank you for spending this time here. Take care of yourself, and I'll see you in the next conversation.